Hello, my name is Shay. I'm going to be your nurse today. I'm just going to put all my equipment here down, and then I'm going to lift up your bed if that's all right. Perfect. Can I ask your name and your birthday? Perfect. Just going to check it against your wristband here. Wonderful. Okay, so we did give you hydromorphone about an hour ago. Did that help the pain that you were having? It did? Okay, so you're not in any pain at all anymore? Wonderful. So I am here to do a catheterization today. Did they tell you about that? You did? Good. So do you know why you're getting a catheter? Yeah, so just since you were having a little bit of a hard time getting up to use the washroom, we just want to ensure that you're comfortable and that to reduce the risk of falls, we want to put in a catheter. Is that all right? Awesome. So I'm just going to start getting everything all set up. I'm going to get this out of my way and put this just on the side of the bed below and tuck this under here for now. Perfect. And then we can bring this over. So I'm just going to put the things that I don't need off to the side for now. And of course I have clean washed hands. I'm looking over my sterile catheterization tray to make sure everything's intact, nothing's broken or damaged, and also that it's within its expiry date and it's not expired. So I can pull this out. And I do have a garbage below me, but I am also going to put the garbage just between Annie's legs there. Is that all right with you, Annie? Thank you. So when I open this kit, I just want to make sure that I'm opening away from myself. Perfect. So away from myself. Then I can grab this corner and do the same in this corner. And then the last fold has a pair of forceps here. So I'm just going to pull this out. Do that so that I'm able to rotate it. Now that I have my forceps here and the tips are sterile, I'm going to grab my drape. If my partner wouldn't mind just lifting up Annie's dress there. Thank you, Annie. Okay, so I'm just going to grab the middle with this, and then I'm going to take it away so I'm not hovering over my sterile field. Place those down, and then I'm able to touch the corners now. So when I place this down, I want to make sure that I'm not touching the middle. And then I can readjust and touch the middle once I have my sterile gloves on. And Annie, this is just to protect you and catch any water droplets that may fall at all. Perfect. So before I put on my sterile gloves, I just want to open my catheterization tubing, my catheter. So I'm going to peel it down like a banana. I'm going to grab my forceps here, and then I can pull this out. And then I'm just going to drop this into the garbage can. And I just want to make sure that this is staying within my sterile field there. So I'm just going to lay that down. And I'm just going to pull this back a little bit because it's just a tiny bit in my way. Perfect. So now that I have all that done, I'm going to go ahead and put on my sterile gloves. And of course I would wash my hands. This can go in the garbage. And I'm going to want to make sure that I have I'm using my dominant hand to grab my non-dominant glove first. This is actually just backwards. There we go. So I'm using my right hand to pinch this with my left glove, and then I can put this on. Perfect. And then I can go ahead and cup the other one, just like this, and go ahead and put that in, like that. Perfect. And I don't need to use this. I can if I'd like, but I don't need it. So I'm just gonna grab it in the middle where it's still sterile and go ahead and throw that out as well. Perfect. So now that I have my sterile gloves on, I can go ahead and I can reach in here and grab whatever I need. So I do already have garbages, so I'm not going to be needing this. I'm just going to throw that out. And I do have an extra 10 milliliters of saline in case I need it. I'm just going to leave that within my sterile field in case I did need this as backup. Perfect. And again with lube, we also have an extra one of those. I most likely won't need it, but I will still leave it in my sterile field just in case I did need it. I'm going to go ahead and open my saline, and I'm going to make sure I'm not hovering over my sterile field. So I can open that up, throw that part out, but then just reaching around, I can go ahead and soak that gauze.
Down here, is that okay?
And we already have done peri-care, so I do need to cleanse the labia before I put in the catheter, but the peri-care has already been done. Go ahead and pour that out. Perfect. And now I'm just going to grab, we're gonna rip off the perforated edge that comes with a catheter so that I can put lube on it and get it ready for my patient. So just opening it. Plastic stuck to me. There we go. And I'm going to pull this out. Perfect. There we go. And again, we want to make sure I'm not hovering over my sterile field in this as well. So now that I have my catheter all ready to go, I'm going to grab my lube here and insert the tip of the catheter into that there. And again, we want to make sure we're not hovering over the sterile field whatsoever, because that would contaminate my field. So now that I have this all ready to go, I can go ahead and put it inside. And just as an extra step to get it ready before I go in there, I am going to attach my syringe to my catheter. That's garbage. When doing that, you just clip it in there like that. Perfect. So my kit is completely ready to go, and I'm ready to bring it over to my patient. So I'm just going to reach in on the inside. Perfect, and bring it right in here. And I am going to let Annie know that this is a sterile field, and try not to move too much or touch anything just while I'm cleaning and getting everything all ready. So I'm going to start out, put it in there, by grabbing my forceps here. Perfect. And tips down always when you have the forceps. And I'm just gonna hold with my non-dominant hand to spread the labia there. I'm talking Annie through this the entire time, letting her know what's happening. So in order to get this cleaned, we wanna make sure we're wiping all sides. So we're gonna start with the farthest side, going from top to bottom, and we can throw that out. And going on my second one here. We are going from top to bottom, and just remembering to go back around the sterile field so you're not hovering over it again. And then for the last wipe, we are just going to go straight down the middle. Right down the middle here. Perfect. And again, just back around and into the sterile field. Perfect, and now I can throw this out. And we just want to make sure we're holding that still the entire time. So now I can throw this out as well because I don't need this anymore. I'm gonna grab my catheter out of my lubrication here. And I'm just gonna ask her to bear down as if she's peeing and get her to cough. And it shouldn't be painful at all. I'm just gonna go ahead and insert that. And I'm inserting it until I get some backflow of urine. And now that I'm getting some urine return, I'm gonna go just 1 inch further. Perfect. And now I can let go, and I can go ahead and inflate my balloon. And I'm also watching my patient's face as I'm doing this, just because if there's any grimacing or signs of pain at all, then I would make sure to stop and deflate that balloon. So I'm looking at Annie's face as I'm inflating. She's looking good. She's not in any pain at all. She's talking to me. Perfect. And then I can go ahead and unattach that. And then I'm going to just grab the end of my bag. The cap just came off as I was doing that out. But this cap was on and I just flicked it off there. Perfect. So I'm just going to hold that part down and insert it here. Perfect. So now that we have that done, I normally would rip this off, but since we're doing practice videos, I am just going to leave it on for now and clip this in. Ready? Perfect, just like that. And before we leave, I do want to let Annie know that She doesn't want to tug at her catheter at all. Signs of infection to watch out for, any redness, pus, a funny smell at all, and also how to care for her catheter. So when she cleans it, we're going to want to make sure that we're wiping from front to back, and that when she is cleaning, that she's wiping away from her opening rather than towards, so that we're not getting any bacteria inside the catheterization insertion site. And I'm also going to lower the bed. Here we go. And I also want to make sure that I let Eddie know that her urine bag should always be at the foot of her bed. It should not be above her hips. We need to let gravity do its thing, and we also don't ever want that on the floor.